Yet again, ambulance workers are taking to the picket line. Several thousand members of 3 unions are walking out today, mainly in the Midlands, north of England and Wales. London and the South West are also affected. For specialist paramedic Tom, it's a frustrating time. He's been in the job for 6 years and loves it, but says the past 6 months have been increasingly challenging.
Recently, certainly in the last couple of years, really exacerbated in the last 6 months, this job has become very, very difficult. We're all very, very tired. The pressure on services, NHS wide, but also on the ambulance service, has just increased exponentially. And it's really hard to be in this position that we're at today, where you're sort of looking from a position of, I don't know how this gets better. I really don't.
999 mode activated.
This is the latest walkout in this dispute about pay. A dozen strike days are planned by paramedics between now and the end of March, including what could be the biggest ever day of NHS industrial action on February the 6th, when nurses are set to strike too. Workers are calling for a 10.5% pay rise. The governments in England and Wales have given NHS staff an average of 4.75%, as recommended by the independent NHS pay review body. That's currently half the rate of inflation. Backdating next year's pay rise to January is thought to be one option being explored.
What do we want? Fair pay! When do we want it? Now!
Not all union member ambulance staff, including paramedics, call handlers and support workers, will strike at once. Under trade union law, emergency cover will still be provided, and staff can leave the picket lines to attend. Although a spokesperson for the Department of Health said constructive discussions with the unions are ongoing, they said it was disappointing that ambulance staff have decided to stage further strikes at such a difficult time for the NHS. Mark Ashdown, BBC News.
Well, we're joined now on the sofa by UNISON's Head of Health, Sara Gorton. Good morning. Thank you for coming in. We've been hearing this morning that it's an icy day in lots of places. The kind of morning where people might have car accidents or slip on the pavement, might need an ambulance. I guess the question is it right to go on strike on a day like this?
So 365 days a year, the people that are out on strike provide 999 response services. And what they've been seeing over the last couple of years has led to exactly the situation that they're out on strike to try and challenge. We've been warning government ministers since July last year that this very situation was inevitable unless they sat down and talked to unions about how they could invest. We've got a workforce crisis going on across the NHS, and that's manifesting itself most acutely in the ambulance service, where those people are at the really sharp end of seeing the effect of pay and staffing emergencies across the health service. So the people that are out on strike are doing it to stand up not just for themselves, but the services they care about, to try and not only shine a light on the state that the services are in, but also to get government to focus on the need to tackle the pay issues that are driving people out of jobs they love in the health service.
Sure, but I just wonder how that will be received by somebody who, say, falls over on the ice today and breaks a bone and doesn't get an ambulance. How do they take on board what you've just said?
So I guess most of those people are in a situation where every single day they're seeing the highest waiting times ever on record. So the time it takes for your call to be answered, the time it takes for an ambulance to get to you have never been as long as they are at the moment. And that's the situation that's led to those people being out on those icy picket lines. Unfortunately, on a strike day, it does mean that the services are impacted. Strikes have to have an impact in order for them to be taken seriously. And that's why it's been such a difficult decision for lots of those people to vote for strike action, to take it. And it's why it's so frustrating that after 2 days of strike action and some positive progress, that the government hasn't done what they need to do in order to get the strikes called off, which is to commit to putting extra funding in and to sit down and start formal talks.
So if somebody calls for an ambulance today, who will get an ambulance and who would miss out? Where is the line?
So all of the services have got very detailed emergency cover arrangements in place. Those will differ across the services based on the balance of the number of staff they anticipate being on strike, the different unions in those workplaces. But the general rule of thumb is that all of the Category 1 calls will be answered, and the Category 2 calls will be triaged. So that where there is, it means that where the clinicians that are triaging them think there is a risk to life and limb, that those people get the response they need. When we've had both of the previous days of strike, you'll have seen you had footage there from people responding from picket lines. So there are escalation routes in progress. We will be keeping in touch with employers very regularly during the day. Every picket line will have somebody on talking to their control room so that if those calls are escalated, they can be responded to. Ultimately, none of those people that are out on strike want to be there. They want to be doing the jobs that they love, and those jobs are just being compromised on a day-to-day basis.
There's an even bigger strike planned, isn't there, in the early part of February. Do you get the sense that any progress is being made? Is there any chance that this is going to be solved, a solution reached in the next few days or weeks?
I would love to think so. I mean, Steve Barclay, the Secretary of State, really changed his tone very recently. We had a very constructive meeting on the 10th of January, and we were expecting some follow-up to that. And it feels like the blockage is at the Chancellor's level, which is really ironic because Jeremy Hunt, only a few short months ago was writing reports as chair of the Select Committee talking about the investment that's needed to resolve the workforce emergency in the NHS. So he knows more than anybody else what is needed. He's also worked with unions very constructively to resolve disputes before. He worked with my boss, Christina McInerney, and UNISON and other health unions to resolve the 2014-15 pay dispute. So he's got a track record in working with us to do this. We just want him to do that again and to put a stop to this before any more strikes are necessary.
OK, for now, thank you very much indeed. Thanks for coming in today.
Thank you.
Thank you.
Now, it was almost